Hello, my name is Chris. I'm a licensed mental health counselor. I actually have a full-time job working with a school district, so my private practice really takes up about 4 hours a day. And in that context, I see individuals and sometimes couples and groups for about an hour to an hour and a half per session. I work with diverse populations, and I can see adults, and sometimes I work with children and adolescents. I work with folks that have a variety of different emotional and behavioral challenges. And my typical day is scheduling one patient after another for about an hour, as I said. And I will talk to them about their issues, the challenges that bring them to seek help. And that, again, lasts for about an hour, and then I will generally chart for 5 or 6 minutes and move on to my next patient. You know, part of the job is to be available to them on call if the crisis arises over the weekend, which is something that prospective students may not realize. The variety of issues can be vast. It can be marital issues, issues of anxiety or depression, issues related to family conflict, and just any number of challenges that the average person would experience in their life that they would come and seek out psychological counseling for. The question also is, can somebody with a master's degree do this? And yes, you can, but it is difficult to make a full-time living with just a master's degree, primarily because of insurance issues and billing and third-party billing, and also because there are a great many people that have a doctorate in psychology, and their credentials are sometimes more acceptable to insurance companies. Primarily, you have to have a bachelor's degree, and generally most folks would get that degree in psychology, but it doesn't necessarily have to be psychology. It could be something such as sociology, anthropology, a general social science degree, but mostly people would get a bachelor's degree in psychology. Following that, you'd also have to get a graduate degree, which generally is a 2-year degree, and that often is in psychology, or it could be in something called counseling or counseling psychology. And following that, you generally serve a period of an internship, which could last from 6 months to a year. That sometimes happens inside your graduate degree, and sometimes it happens after your degree is awarded. In where I reside, you're required to work under supervision of a licensed person for about 2 years, or put in about 2,000 hours, depending on the individual state statutes, before you can sit for a licensing exam. And once you're granted your license, you're eligible to go into private practice and work as a solo practitioner, though not many folks do that. Not many folks actually work in private practice with just a master's degree. It's a very competitive field and very challenging to support yourself just through private practice. But you can do it. And often folks will work for agencies such as state social service agencies. You can work in the criminal justice field and a lot of other areas where social services or social services are provided, and you can do that with your master's. But again, the private practice is kind of a challenge. If you're truly going to pursue this as a career, the recommendation would be to follow your master's degree or go to a doctoral program, which could add on an extra 4 or 5 or 6 years following your your bachelor's degree. Certainly the best part of working with people is the opportunity and the chance to help folks overcome personal crisis, personal challenges, to be able to affect change or see yourself being a change maker for people who may be suffering emotional or personal distress for any number of reasons. And I guess hand in hand with that, the worst part is that you don't always have a great deal of success. People, while seeking change, find it difficult to make changes, and they tend to fall back into habits that defeat their own attempt to achieve change. And that can be frustrating when you're trying to help them make good decisions and change behaviors that are self-defeating, to see them fall back into those bad habits. An obvious example would be somebody that may have a drug or alcohol addiction, that you've helped them work through those challenges, but they fall back into those bad behaviors. That again can be the downside, or the part that creates some individual distress. One of the other worst parts is the chance that you take on a lot of the pain and suffering and hurt that you see, and that you carry that with you outside of the practice office. It's not unusual to feel empathic for folks that are struggling and to carry that into your own personal life, which raises the issue that if you choose to make this a career, you've got to find a personal strength to separate the pain that your clients are feeling with your own personal life. And that can be challenging for young people particularly, who've so desire to help, but then see the help not being as successful as they might have. One of the other downsides for this career can be that it often is a 24-hour-a-day job. It's not at all unusual for clients to call me in the midst of a crisis on the weekends or late night and seek my help. And again, being able to set your own personal limits and your own personal parameters about how to handle that is another requirement. And all these challenges can be overcome, but they do present themselves, and it's, for a young person, it's part of what they may not realize takes place in that context. And clearly, one of the more important pieces of advice would be to learn to empathize, to understand diverse populations. It's common sense that it's difficult for a young man who's choosing to be a therapist to empathize clearly with a young female if they've not been exposed to the differences in the nature of those different populations. So I would encourage folks to get involved with diverse groups, and you could do that through volunteer work. You could do that through working with Boy Scouts, Girl Scouts, volunteering at churches, volunteering in hospitals, daycare centers, anywhere that you can get more exposure to individuals. I think the other recommendation I would make is to round up your formal education as much as you can. Learn what other populations think and feel and how they are different from a typical American population. And I can do that, or I suggest that you can do that through reading. And I think reading anything and everything is good. Reading novels can provide insight when a novel is set in different periods. Reading about, again, different populations and different cultures, different ethnicity. The more you read, the broader your education and the broader your appreciation of diversity becomes.